Alrighty. Hi, everyone. Excited to see so many new faces trickling in. My name is Charmaine. I'm super excited to see you all here today. I am a fourth year medical student in Chicago, and I am one of the Health Justice Fellows with SMA Social Mission Alliance this year. I'm super excited about the really lovely next hour that we're going to be having together. I am particularly excited about this session today because community organizing and spaces outside of medical education have been really central to supplementing my own education as someone who's been invested in health justice and health liberation for a long time. Yeah, I'm excited for this conversation. Thank you all for spending your Tuesday evening with us. On behalf of SMA, we are super excited to welcome you to the SMA's Learner Engagement webinar. Titled today, the Undercommons Community Student Forums for Fugitive Learning. So these webinars, they used to be a part of the SMA Student Assembly, which has now transitioned into our learner engagement initiatives. These are a forum for health professional trainees and lifelong learners at all stages of their education to engage in dialogue on issues impacting health professional education and the ability of our workforce to advance health equity in this country. We hope to continue using this forum to allow for greater inclusion of perspectives from the community, from patients, from educators, organizational leaders, and learners in realizing the change that unites the Alliance. We believe the transition from the Student Assembly to this current formation of learner engagement will strengthen connections across the SMA necessary to realize the collective vision that brings us all together while still maintaining a home base for student activism and organizing. So the webinar topic for today is unfortunately very topical to our contemporary moment as anti-DEI policies threaten to eliminate the programs that facilitate community involvement in the training process itself. Learners and community members are taking it upon themselves to create new spaces for fostering critical dialogue that advances health equity wherever they are. During this webinar, we will highlight ways and spaces for anti-oppressive study and action that can be sustained for learners and community members, whether formally inside and outside or outside of the community and the academy. So this will be a panel followed by an open Q&A and then optional 30 minutes at the end for unstructured discussion for those who wish to remain on and chat with some of our wonderful panelists. So I'll just get right into it and very briefly introduce some of the folks who will be chatting with you all today. So we'll be hearing from Patricia Tracy, who is a longtime community organizer and a retired community engagement coordinator at Johns Hopkins School of Public Health. We will be hearing from Dr. Ike Enema, who is a second-year preventative medicine resident at the University of Maryland, Baltimore, who has done work in emergency medicine and youth organizing. We will also be hearing from Dr. Monica Hahn, who is a clinical professor in the Department of Family and Community Medicine and the Department of Obstetrics, Gynecology, and Reproductive Sciences. And last but not least, we will be hearing from Sam Dennison, who is Dean of the Institute for Street Level Learning and an educator, artist, advocate, and resident of San Francisco. So now I'll just let the panelists themselves take a little bit of a longer moment of time to introduce themselves. Maybe you all can share your names, describe your work and the work of your organization, if applicable. And we would love to hear a little bit about your experiences in health professional student education on topics related to health justice. So Patricia, maybe you can start us off.
Okay. Well, Happy New Year's to everyone. I know it's not the beginning, but we're still in the new year starting. I'm Patricia Tracy, a retired community engagement coordinator for the Johns Hopkins School of Public Health in the Department of Environmental Health Sciences. Prior to that position at Hopkins, I also worked in the Department of Health Policy and Management, was very helpful in understanding the research data and what the data had to say. Although my education degree is in administration and management, community engagement became my passion. I worked with students, community members, health professionals, addressing health policies and environmental health issues. I became the student as I learned about the disparities in healthcare and environmentally toxic issues found in Black, Brown, and low-income communities. As a community engagement coordinator, it was my task to connect students and researchers with community organizations and the people of the communities to hear both sides of the issues and to form partnerships. The partnerships were with students from the School of Public Health, the School of Nursing, the School of Medicine, and many organizations focused on environmental issues. In doing this work, I learned that the best way we can help impact the communities was to listen to their stories and not tell them what their stories are. It was also important to share research findings by working together to figure out the best way to present the findings and to find meaningful ways to involve the people who we are helping. And and that was sometimes as simple as just talking to them, walking through their neighborhoods and joining them in their community events. Thank you.
Thank you, Patricia. Ike, if you are down to go next, we would love to hear from you.
Yeah, thank you. Hey everyone. My name is Ike. Happy New Year. Good to see you, Miss Pat.
Hey.
Um, I'm currently a preventive medicine resident at the University of Maryland in my PGY2/MPH year. I've been living and learning and training in Baltimore City for a little over like a decade now. And I spent most of my time as a med student really organizing and learning in East Baltimore and learning a ton from historic and lifetime residents of the city and of neighborhoods in East Baltimore, specifically the Middle East neighborhood. Um, so much of what I've learned and gained, regardless of whether inside or outside the hospital, has been from working with and organizing with communities in East Baltimore and specifically the Baltimore Redevelopment Action Coalition for Empowerment, which not to put you on the spot, Miss Pat's the leader of the predecessor to that organization, which is called SMEAC or the Save Middle East Action Coalition. And so much of my experience was kind of learning the legacy of that neighborhood and learning the history of that neighborhood, and its relationship to the institution that I was getting my education, and so much of really the harm that had been done to this community, um, at the actions and hands of where I was getting my education. Um, and like I was saying before, I was very fortunate to be welcomed in by this community, and welcomed in by its leaders, along with my classmates, and to really learn that history, to learn what it meant to care for people in Baltimore City, um, to understand that medicine could really and should really be beyond the walls of the hospital. We spent a lot of time after we had first kind of gotten acquainted, um, really building out mutual aid efforts and sort of networks of care within East Baltimore and beyond with Brace. And that's been a huge and meaningful part of my education up to this point. I'm now, getting my education in West Baltimore and trying to take a lot of those, practices and lessons that I've learned with Brace and still keep in touch with East Baltimore and still keep in touch with Brace, but really just keep the principles of health justice education and being a lifelong learner and, you know, taking cues from community members who know their histories and know, their situations better than anyone else. And so I'm really grateful to be here and just share pieces of that with everyone.
Thank you so much, Ike. Very important work. Monica, if you want to introduce yourself.
Sure. Hi, everybody. I'm Monica Hahn, she, her pronouns. I'm really honored to be here with other amazing folks who are so dedicated to health justice. It's just so affirming and nourishing. I just want to say to be in spaces like this, especially in the current moment. And I'll say just it feels so good, especially because I know my passion for health justice and in public health and medicine has always been the driving force behind how I show up for this work. And I know that's true for so many of you here today. My clinical work mostly, I'm a family doctor by training, and my clinical work mostly centers on family-centered HIV primary care and perinatal HIV care. I'm the medical director of Hive Clinic, which is the perinatal HIV program at San Francisco General Hospital. I also do some public health HIV capacity building work as well. But one of the things that I'm the most passionate about is teaching medical students and residents with various roles in medical education at UCSF. So one of them is being a teacher and a mentor in the Prime Urban Underserved program, which is a supplemental health equity leadership pathway program at UCSF, which I actually graduated from, so it has a special place in my heart. And I also have some roles in the Anti-Oppression Curricular Initiative and several other advocacy roles that I have outside of work, especially nowadays, that include the Institute for Healing and Justice in Medicine and a few other advocacy organizations. And yeah, really, I see my work, whether it's like sitting with patients clinically or teaching students or, leading systems change in public health. I see like, even though those are all very different things, I like see my role as really being a vehicle for advancing health justice in whatever I'm doing that day. And just recognizing that it's lifelong learning, and that I'm constantly interrogating my own privilege as well. Like I may have humble roots as, daughter of immigrants, first in my family to go into medicine and to navigate like all that hidden curriculum and like the unwritten rules of surviving residency and a tough career in academic medicine. And I very much recognize that the immense privilege I have as a physician, and how I recognize that that privilege like literally increases the older I get as well. And I really believe that with that increasing privilege comes increasing responsibility, and that like ability and like obligation to hold ourselves and our organizations lovingly accountable for change. And that's like what I feel like. That's why I'm here now. That's what I'm doing. And looking for good company for making good trouble all the time with. And just very briefly, my background before medical training was in ethnic studies as a scholar at UC Berkeley, where I really dove deep into like critical pedagogy. I was heavily involved in community organizing and community-based participatory research long before I had any idea I wanted to become a doctor. And I was a student activist. And honestly, when I did decide to go into medicine, it was interesting because I was actively counseled like not to include any of my organizing work on my medical school application. They said like those skills won't help you as a doctor. But it's just so interesting because like that work and like those movements that I was a part of building, like those struggles for solidarity and liberation were actually like the strongest lessons, and like the strongest skills that I think I've brought with me to being a healer and a physician advocate, and a medical educator, I think. So I'm really grateful for those foundations and those experiences that I have today. And I hear echoes of that in everyone else's intro. So I really appreciate that. And so, yeah, I'm really looking forward to talking more about my roles in medical education and how some co-conspirators like Sam here and I have partnered in trying to bring in community engaged work into medical education. So thank you. So nice to meet everybody.
Wow, so inspiring. Thank you so much, Monica. Definitely relate to a lot of that. Sam, we will have you round us out.
Oh, thank you so much. And thank you also for inviting me. I know that there are all kinds of risks and upsides and downsides to inviting community members into meetings like this, places where, the hard work is being done of institutional change. And I just want to say I feel honored and just very special to be here. So I thank each and every one of you. I am called the Dean of the Institute for Street Level Learning. My background was 25 years in higher education, in the kind of education that served communities of color and communities that often did not have access to education. I was the dean of a number of different campuses, and now I am with a live-work community called Faithful Fools, which is located in the Tenderloin district of San Francisco, which is a highly impoverished community in an incredibly wealthy city. And it is a place where, when we think about how we navigate poverty and separation in our culture, this is the kind of community that bears the burden of that. That is to say that the San Francisco says, we don't want poor people living on the streets, but we don't want poor people living in our neighborhoods either. We don't want to see all the mental health issues that are plaguing our families, but we don't want our sisters and brothers who have mental health issues living in our homes. We don't want to see drug being used, but we also don't want safe injection sites, except, oh, by the way, when it's my living room and that's a safe injection site for me. What we do is we take the things that we are most ashamed of and project them onto communities. We often talk about them as communities of color, and I think that is true. And I also now really find in my own life that those issues of separation, segregation are really founded in class issues, to be honest. The issues of I have mine and I don't want to think about where mine comes from. And, all of these things that we're watching happening at the moment in the larger world, especially in Minneapolis, where I spent a number of years of my life, we see this playing out in all the disguised language of they don't belong here, they are breaking the rules, my family came here the right way. There are all these different ways in which we are creating separation. And that's also true in the healthcare field, where we think of there are the people inside the institution and there are people outside the institution. There are people who are healthcare providers and there are people who are in the community seeking healthcare. But the reality is that we are all living in communities that are struggling with health issues that are bigger than any one of us. And so when we can be in partnership with each other, in community with each other, thinking about how we have more healthy communities, we are all better off. And so, like with Monica, I have just the deepest regard, but also a deep working relationship with Monica, where we can be very honest with each other about the things that are working and that are not working. And we can take our critique to the powers that be within the healthcare system, but we also take our critique to the people in the community and say, it is our turn now to step up and speak our truths. And that's where a lot of our projects have come from. And that to me is ultimately the biggest honor, is being able to work with people who are living on the streets in collaboration with doctors and nurses and medical students, and know that we are forming a community of health and strength that has a vision for what a truly equitable society might look like.
Wow. Thank you so much, Sam. That is also the perfect segue into our first question for the evening. So I'll just go around and call on our panelists to kind of answer one by one. So the first question, it is two-pronged. So first, we would just like to hear a little bit about how your work in education has tangibly been able to cross the border between the academy and the city you call home. And then the second part of that question is, how has your experience then in education encouraged other learners to also cross those very same borders? And Sam, maybe we can start with you, just because it's kind of a continuation of some of the stuff that you just spoke about.
Sure. Well, I will tell you, I'll just give you the greatest example of, crossing those boundaries. And first, I will tell you that as a fool, which is the name of my organization, a fool is often the trickster who can cross borders and be in many unfamiliar places and yet remain themselves. And I think those of you who are on this call probably share that characteristic with me, that you will go places where people will think, oh, here's a white coat who's just like me, but in fact, you're thinking a lot of different kinds of things and taking new ideas with you. You will all remember that first week of the pandemic, those first weeks of March 2020. And here in San Francisco, the lockdown orders came with an order to empty shelters for homeless people and to reduce the population in the jail by 30% and to reduce the number of people who were in hospitals who were not in critical condition. And all of those people were emptied out onto the streets, but they were not allowed to be in just any old neighborhood. They were sent to the Tenderloin. So in San Francisco, where you could hear a pin drop for blocks and blocks and blocks, in the Tenderloin, we had people standing literally cheek by jowl. And in a time when we were supposed to be social distancing, we had no masks. We had no distance to have between each other. We also had no fresh water as the convenience stores were closed down and the libraries were closed down. And the only people providing water were the public kitchens that were handing out thousands of bottles of water a day, which was nowhere near enough for the population we had here. And we had no sanitation facilities. So it was a highly it was a critical moment, and the city was overwhelmed with the notion of having to provide services on the streets, as well as meet the needs of the rest of the community. And in that moment, a friend of mine, Paula Fleischer, who worked in the Center for Community Engagement at UCSF, called and said, "Look, we have these faculty and students and staff who cannot meet in their classes, and they are not content to do nothing, but the school has said they cannot be in person anywhere. And so, what can we do to help?" And we immediately convened what we called the Monday calls. And, we said, we need hand sanitizer. And students and faculty said, yes, we can get that. We can figure that out. And pretty soon we had gallons of hand sanitizer arriving. We need masks. Yes. And suddenly there were people who were sewing masks and were creating masks and were pilfering masks from all kinds of stockpiles here and there. We need gloves. They appeared. And then because the city was also simultaneously trying to reduce the number of tents on the street, and don't ask me how that happened because that was just another crazy story. So they were confiscating people's tents. So then people who were living on the streets no longer had any shelter on the streets. And so we asked for tents. And along with other communities, the UCSF community came through with hundreds of tents, and we were able to supply our neighbors with stable shelter and a place to sleep. This is one of those borders between the educational facility and the community that is just so dramatic, right? And it doesn't only happen when there is a pandemic and, this worldwide crisis. We see this on a regular basis, whether it's with residents in the family and community medicine department or first-year medical students. Whenever we can, we end up with people coming into the neighborhood, and it speaks highly of where our ideology is today, that 9 out of 10, 99 out of 100 folks who come from the medical field into the neighborhood first ask, what do you need? They don't say, I'm here to help you, or I'm here to fix it, or I know what you're doing, right or wrong. There is a general sense of, what do you need? The biggest issues that come along are that there are large nonprofits that love having a partner in a huge medical system, and they tend to have a little dance with each other rather than including community members. And the place that there is an opening yet for us to do more of this work is bringing in more community voices. And that's something that I would let Monica speak to, because one of the projects that came out of this was where I originally came across Monica and then eventually met her, is in a project called Community Grand Rounds. And I don't know, Monica, do you want me to tell about the story on the Monday call first and then you go on, or do you want to tell that story?
Yeah, sure. Why don't we go ahead and start briefly, and then I can pick up.
This will be like a few sentences here. On the Monday call, we had one day where one of our community members spoke to the recent death of a performer in our neighborhood, an artist in our neighborhood who had been seeking care for months and months and months at the emergency room. And the critical signs of septicemia and sepsis were really being missed. And by the time they were discovered, it was a fatal event. And it was a crushing blow to all of us, because not only did we love Dino just as a neighbor and a friend, but to realize that his struggle to find care was not successful. And then we doubly realized that those who were providing the care, because of the structure of the care that he was getting, weren't able to pick up these indicators of the sepsis. So it was a hugely tragic moment, and we all just felt like we need to tell our stories, and that's where this Community Grand Rounds project began. So Monica, you pick up the thread from there.
Sure, I hope that's okay order-wise. Charmaine, thank you. Yeah, but before I pick up a bit more, I just want to frame it by saying, Sam and I are, I appreciate Sam so much as a real like a confidant, like comrade, thought partner, and like accountability partner, so much in all this work that we've done together. And that Sam probably didn't really say this, but they have actually a like honorary status in our family and community medicine department as a senior community advisor, and that's like one of the first times that like at least at our university at UCSF that they've ever like given kind of like a recognition of like almost a faculty status to community members, and that we like pushed really hard to like have that honoring folks, honoring lived experience as much as a PhD or as whatever else in the ivory tower that we assign worth to. So I just want to say, like, I think that Sam doesn't like toot their own horn enough, and I wanted to say that as well. But something that kind of frames it as well as far as like the how do you cross that bridge, or like build a stronger bridge between academy and community. A couple years ago, I had the real like honor to learn directly from just a super inspirational Dr. Kamara Jones when she was at UCSF as a presidential scholar visiting. And something that Sam and I talk all the time about is that she always said our goal should be to make institutional walls more porous. And I think that like what that means to me is that like we need to be dismantling the silos between like academia, like on this ivory tower, and like the community, and to like make institutions more connected to and more accessible, and more accountable to the communities that they serve. And that's what I think about constantly when I try to cross this border between academy and community. One of the quotes that like, or one of the opening things that Sam and I often bring up when we might be teaching like a community engagement 101 session to like prime students or to like family and community medicine residents, we like to share this beautiful quote from Eduardo Galeano, which is, "I don't believe in charity, I believe in solidarity. Charity is so vertical, it goes from top to bottom. Solidarity is horizontal, it respects the other person, and I have a lot to learn from other people." And I think that quote just like really like embodies and like summarizes how my approach and just like our collective approach has been to our mission and vision for the community engaged work we do. Like a lot of times I feel like traditional medical curricula or in healthcare institutions in general, care is thought of as like a charity or like as a service to the community. But our goal is to like reimagine what like true care means when our collective goal is solidarity, health justice, collective liberation, right? We're not doing something for communities as a charity, or we're doing something with communities and like led by communities, and like learning and healing collectively happens in community. So to me, I just wanted to say, like, as far as that, like crossing that border analogy, I just feel like it really means like we're trying to design learning experiences where community members are not just like guest speakers or like isolated, like you get invited once to speak on a panel, and it's like a voyeuristic kind of way, but it's or like case studies, and they're not just afterthoughts in the curriculum, but it's more like community members are respected as teachers and as experts, and as co-creators of knowledge. And so that also means like helping learners understand that some of the most important lessons about health will never come from like a lecture or a textbook. It'll come from like being in community with other folks. And so some examples where I feel like that's manifested really well. I think the best one is Community Grand Rounds, where it's just been a really transformative project for me and like all of us who have been in it. I think this is a partnership, as Sam was saying, between community organizations and the Tenderloin neighborhood of San Francisco. So that includes Faithful Fools, where Sam's from, Skywatchers, which is one of the amazing performing arts organizations in the Tenderloin. And it really uplifts the voices of Tenderloin community members who have experienced harm from the medical system. So what happened was we created a space for basically people who live in the Tenderloin who have experienced different experiences with the medical system, which were mostly harmful experiences. There are also positive experiences, but we had an amazing documentary filmmaker basically interview folks and give them space to tell their story in a way that they've never been able to before. And we brought them together with healthcare workers and trainees. So often we will do this with our like prime class that I teach, or with residents, or with just any other healthcare workers, and we'll sit in dialogue and watch the documentary videos and see hear people's stories, but then also use a restorative justice model for dialogue amongst the community experts is what we call them, our community members who come, they watch their own story actually, which is very powerful in a different way. And then we all sit around in a circle and kind of go through a restorative justice process where we talk about how the story has affected us, listen to the community member who had this happen to them, and hear their recommendations for how we as learners and we as healthcare providers could have prevented the harm that happened, or how we can fix it going forward, and what are the systemic problems as well that led to them. And so we've really I'm very lucky that I get to teach a yearly class for the graduating prime students called the capstone course, and we've really integrated the community grand rounds process into it. And so that in that final year, the prime students are kind of like trying to learn or kind of wrap up all their learning, or like revisit everything they've learned about social and structural drivers of health throughout their time in medical school. And we really use these like principles of Freirean education for critical consciousness, and bring up these themes of restorative justice and advocacy and critical reflection and dialogue to have this experiential learning. So yeah, that's a bit about the community grand rounds. It's been a really wonderful process. Some of the really magical things that have happened after too are really inspiring. Like a lot of times the prime students who experience community grand rounds, like they befriend a lot of the community experts, and then like a year later when those students are like then in residency, they have like invited us to do community grand rounds with the same speakers, like but for the residency program. So like we've done that for like the emergency medicine residency program and like surgery, just thanks to these like organic connections that were made. And yeah, so I want to take more time because I want to hear other examples from other folks, but I can give other examples as well of other ways we've integrated community engagement work into the rest of our work. Thank you.
Thank you, Monica. Thank you, Monica and Sam. It was really beautiful to hear kind of both your responses in conversation with each other as well. Ike, I'll pass it over to you to kind of answer this similar question about how your work has been able to cross this border between the academy, the institutions, and the places that you call home.
Yeah, thank you for the question. And thank you so much to Monica and Sam again for sharing your experiences and your wisdom with us. Um, yeah, I do feel like in my role as a medical trainee in the institution that I was at, that felt like very much a responsibility that me and my classmates took upon ourselves, really to yeah, facilitate sort of this bi-directional flow of resources from the institution into the community, and also doing our very best to bring community voices and community presence and community body into institutional spaces where they've been historically denied. Um, and especially feeling that when there has been such a long and documented history of harm on behalf of where we were getting our education, that felt especially important, still feels especially important. I think speaks to why I initially stayed for residency where I did, and tried to continue some of that. But to backtrack, um, part of how we got introduced to the Baltimore Redevelopment Action Coalition for Empowerment was through organizing at the time against a private police force that our educational institution was trying to implement sort of at the onset of, or before the onset of the pandemic. And this was going to be initially implemented in East Baltimore, where the communities that we've been organizing with would have been the first to experience this private police force and had been in stark opposition to it. Despite that, the institution was sort of kind of like speed rolling the process of implementing this police force. And so we'd been invited by the president of the Baltimore Redevelopment Action Coalition for Empowerment at the time, to talk about how to resist, this police force at the time. And that initially felt important because I think one thing that feels important to recognize was there were other sort of avenues to partake in community experiences in the institution that I think were very much sort of controlled and almost curated by the institution so that students organically may not have interacted with community members of their own accord, or on their own. And if we had kind of, stayed in within those walls and stayed within those bounds and sort of just trusted where we were getting our education to tell people stories and to share with us about the place that we were, living and learning, we would have never met Donald. We would have never met Brace. We would have never met Miss Pat. And so that felt like an important lesson to take away, which was it is important to make these bridges. And I also think it's important to recognize, especially when there are histories of harm, that going around the institution can be just as, if not more productive in making inroads. And so we initially met during that first meeting. This was, end of 2019, and then the pandemic hit, and we kind of deepened our relationship and deepened our systems of care and mutuality. We had started sort of a food drive for folks who had trouble getting groceries or leaving their homes during the pandemic, for folks in East Baltimore and beyond. Um, and I think there was just a lot of, mutuality in our experience in the sense that we were going through a pandemic, getting our medical education. Things were very difficult, I think, on us medical students who were trying to organize for justice within our institution, and hold our institution accountable. And I think, a lot of my classmates can speak to the reality that we were feeling so much more love from the community than we were, where we were getting our education. Um, and that really sustained us as much as, we were hoping to show up to, take their lead and hopefully share our skills and resources and bring institutional resources into, what their, initiatives and objectives were. Things as simple as like sharing your institutional Zoom or trying to get masks from community or from institutional resources felt like things that we could provide while we were really just learning and experiencing and being loved on. And as far as how that kind of, I guess, trickled down beyond us, I think a lot of our classmates saw that, and especially at the time, having the support and network of SNMA, the Student National Medical Association, was huge. A lot of us were showing up for Brace, and at the time, the president of our executive board, I think we were very lucky to have a fairly strong and large executive board that could do a lot to organize in community and hold the institution accountable to its stated missions about, racial justice and equity. Um, we made it a conscious decision to have, a position on the executive board that was sort of dedicated to show up at Brace, for years to come, to ensure that like that institutional memory kind of, stays within SNMA and stays present. Um, and so that's kind of, I think, how that work continues beyond us, even when, many of us have graduated. Um, I think it's also been important to recognize, when the institution isn't ready to adequately compensate um, community members for their time. Um, that also feels like another important avenue to recognize. You can still continue doing the incredible work you're doing in partnership, without that direct curriculum integration, it was really important for us to, I think, have that piece of folks who are coming here to share their stories again and again, beyond an SNMA meeting, because that was beautiful. It was wonderful to have folks come and share their stories with SNMA. But if that's going to be a part of the curriculum, and there are folks in this crowd who can speak to it better than I can, um, the institution really does have a responsibility to recognize its pattern of historical harm and to compensate and repair and provide reparations to folks who have lived through that. Um, and so when I graduated medical school and stayed on as a resident at the same institution, my co-residents who had come from, different parts of the country and other training institutions quickly recognized that and sort of joined in that fight. And we tried again our intern year and got were met with a bit more censorship and kind of the same unwillingness to compensate community members adequately. But that hasn't really stopped us from, again, trying to hold on to that institutional memory, pass it down to the incoming PGY2s and PGY3s or medical students behind us to continue to hold the institution accountable to what it says that it claims to want to be a champion for. And so, yeah, I'll leave it there. But those are a lot of the things that came to mind.
Thank you for sharing. Miss Pat, if you want to round us out.
Okay. Um, uh, I'm listening to what everyone's saying, and I think it's so great. And that's one thing that we have to do. We've got to come from beyond the walls of the institutions. And that's what we did as a community engagement coordinator. We worked, I'm saying we, because I worked with Barbara Bates Hopkins. And what we did in 2007, we created an event called the Day at the Market. And it's the Northeast Market that's like 2 blocks away from the Hopkins East Baltimore campus. And what we did there, I'm sorry, what we did there is we were able to bring together like the doctors. I'm sorry, I keep getting the, and you, oh, is that what was going on? I'm sorry. And so what we did with the Day at the Market, we were able to talk to residents, and we were looking around and we saw that at this market there were a lot of empty stalls. So what we decided is, let's talk to our community partners and see if we can fill those stalls with people who could bring doctors, who could bring services like flu shots, talking to people about their health issues, and started with the environmental health issues, where we talked, we wanted to know how much people knew about environmental health. And they didn't. So we felt like this was an opportunity to bring people together with the researchers and events and activities that they could participate in. Because when I would ask them, if you had a question about what's happening to you in your community, where would you go? They said Hopkins. And I said, where at Hopkins? Who are you gonna look for? How are you gonna know how to navigate through that? So we started first with doctors, and we asked them when they came to the market to wear their white coats so they would be easily identified that I'm the person that can help you. And it just caught on. And when doctors started coming there, they started thinking about their research, because a lot of times you can't help a person until you know what their problem is. So we brought the doctors there to talk to the residents, and they weren't the doctors weren't afraid of the residents. The residents were glad to see the doctors come out and to have access to them. So that was kind of very meaningful, and it caught on a lot. And we just wanted to make sure that it felt like a safe place. and that was important to the residents and to the doctors and the students. You know, Barbara and I, we would talk. We went to the School of Nursing, and the new nurses coming in, they wanted to work in the community. So we would like, okay, let's just have conversation. So we would talk about the nurses, what they do, and like blood pressure, something as simple as taking blood pressures. A lot of the residents wouldn't didn't get their blood pressure taken on a regular basis, and so we would bring those student nurses. When they came in, they were like the biggest help ever to bring down to the market to be available to the residents. And also it kind of went into all different areas. We had people coming there to talk about health insurance, talking about AIDS, and um, you name it, any kind of concern that the residents would have, we could find somebody to come to the market and talk about that. So that's about, you know. Oh, there's one of the activity we had was confronting asthma where it lives. So we looking at data in low income areas, zip codes, and we found out there was a lot of asthma and lead poisoning, bad demolition practices. All those things were going on in these lower income areas. So we did an asthma project with the middle school, who had been working on a community advisory board for over 20 years. They wanted to present the data, the information, so we decided to do a family feud game. And at first, we weren't sure how it was going to take off. We had over 250 people show up, and the school got very involved with it. They had their art department do posters talking about asthma. So it got people talking about this one particular um, impact or that was happening in their communities, but everybody got involved in it. So when we because at first the researchers wanted to do a symposium. I said a symposium is not going to work in a community. We have to do something with fun, and it worked. So those are the two things: the day at the market, and I love the confronting asthma where it lives. Okay.
Wow. Thank you all so much for the reflections. I'm like furiously writing down notes and questions. So this is great. In the interest
Okay.
of time, I'm going to combine our last two questions into one larger question. So we can start with Ike, if that's okay. We would like to know, how has your approach to health justice education changed, if at all, in our current political climate and current political moment? And kind of within that context, what advice would you give to trainees and or educators who are committed to health justice in this moment of institutional retreat?
Yeah, thank you for the question. I would say to answer the first one, my approach has partly changed because I'm in a different institution now. I'm a different part of the city, the different historical context and different communities, and so I felt like that is important to acknowledge. Um, Alongside just, like the current political climate and an administration that's really bent on censorship and tearing down pillars of DEI. I think both have kind of led me, along with past experience, um, to initially testing the waters with my current institution, and leveraging opportunities for education and bringing um, community stories and community voices into my education where I can. And so, as for an example, I'm in my MPH here, and so a lot of it is like writing papers and doing presentations. And so I decided, like, for my first, larger presentation and sort of like final paper for a class, like I'm gonna I'm gonna bring myself and bring my education and my experiences into the classroom. I'm gonna do a paper on serial force displacement in East Baltimore and as much as I know in West Baltimore, and that really all of that I've learned organizing alongside Brace and learning from leaders like Donald Gresham and Miss Pat. as well as other scholars who have really done the archival work to tell these stories. And just doing things like overtly naming racism and racial capitalism and the institutions who have committed forced displacement in the city and the forces that have been responsible for that in the presentation, both for the sake of my classmates, just like so we can share in that knowledge and education, naming the organizations and community organizations who are still doing the work to fight for housing justice, to fight for the historical residents of their neighborhoods, just putting that in the material and, you know, getting a sense of like what pushback and censorship should I expect from this institution? Because we tried to do similar things in my first residency, and we're met with censorship. We were met with responses that, you need to launder the history of the institution. You need to say the things that they've been doing well or the ongoing initiatives, which sure. But that was kind of my first approach. And, thankfully I was met with a lot of support. I've been fortunate to have a lot of educators who have, at least at this institution that I'm currently at, who have either, somewhat familiar with this history, have organized themselves, and are really just, down with keeping this education and these stories alive. Um, and a few of which who, similar to myself, are kind of doubling down in the face of in the face of censorship as much as they can. And so I think there's a recognition, especially with respect to students and trainees, that, I think seeing folks highlight and elevate the like community stories. At least I've been fortunate enough to see, I think, that even if faculty or educators don't feel that they are in the position to do that for whatever reason, I've been met with a lot of support with respect to that. So that's been one approach, is like trying to find the pieces of my education of my MPH this year that can be opportunities for sharing this information and getting the word out to my cohort and my classmates. And another piece of kind of choosing to continue my residency here was seeing to what degree like service learning experiences or participatory community experiences were already implemented or part of the curriculum. And that is something that has been present here at the University of Maryland. There is a fairly young but really strengthening relationship with the Still Meadow Peace Park in West Baltimore, that we as MPH students are, required, like mandated to participate in. And it's honestly very joyful. They're a faith community in West Baltimore that's stewarding 10 acres of land for food growth and development, for like scientific and learning experiments, and doing things like growing trees and cooling parts of the city. And it's been a really beautiful thing to see faculty and students learning like how to show up and just be like, what do you need? Like how can we leverage our resources and our education to really serve your mission? And so that's been a green flag. It doesn't feel like I'm watching my educators show up somewhere and be like, we're about to run the show, which I do appreciate. Um, and in addition to that, there is sort of a community engagement center in West Baltimore that I'm really committing myself to try and spend more time at, because it's really somewhere that folks in the Baltimore community are encouraged to just kind of make their own. Anybody can come. You can use their spaces. They do things like free grocery giveaways, and they have like a make space where you can sew and create things. They have events for kids. So it's every moment I've spent there has felt really meaningful. It really does feel like folks are making it their own, and it's been an opportunity for me to learn in a different part of the city and learn from folks in West Baltimore, and remind myself that I'm somewhere new. I need to humble myself all over again and continue to do that, and I'm really grateful to be able to. And so that's kind of a piece of both. As far as advice, I'll try and keep it short, but really just some of the same stuff I was saying before. For learners, there really is, like, if you're blessed enough to have it, there really is strength in numbers, whether that's in, your affinity organizations and SNMA and LMSA, or just, your band of, inter-educational folks, nursing students, med students, like getting together, I think is huge. And just gives you more power to hold your institutions accountable. Like I'd mentioned, when we were, a stronger SMA executive board, we had the time and the resources to write out an entire like report on what our institution wasn't doing, and what they could be doing to further racial justice within its walls, and to try and continue year by year to hold them accountable. Knowing that the work you're doing within community is timeless and it's going to outlast administrative changes. So just having faith that like what you're doing is worth it, whether it's, supported, elevated, or funded, um, and learning to be creative when it's not. Um, yeah, I think those are the main things that come to mind. I don't want to take too much time, but I really appreciate the opportunity.
Very cool. Thank you so much. Miss Pat, we would love to hear from you.
All right. I like to echo what Ike is saying. It's very important, to keep the work going. And I'm not in doing really active community engagement work. People still find me and try to see who I can get to hear what they want to share about the work that they're doing. I work with one group that talks about the redlining and gentrification and urban renewal. Sometimes we don't really see those things um, as clearly as we should, but those things are happening. And I work with the group so that they can continue to keep that out there, that these things are still happening even now. And only other thing I can say is those of you who are doing the work, just keep doing it. Thank you.
Love that. Thank you so much. Sam, we would love to hear from you. The questions are, how do you feel your approach to health justice education has changed, if at all, and any advice?
Well, I'm gonna give a little bit away here by saying I came of age when Ronald Reagan became president of the United States, and I remember feeling very much the same then, although it certainly is highly magnified now. But I could feel this was the road we were on as Prop 13 here in California was passed and a variety of other things happened. How has my work changed? I don't think it's really changing. I think there are good times and there are bad times for the work, and there's a lot that's going on. I think what's changed in my own heart is I'm deeply worried about the people I care about. I'm deeply worried about the mobilization of violent forces in our country. Um, and that worry can be erosive, which is kind of what leads to the advice, which is, to echo what Ike said so beautifully about do it together. One of the things that I say to people all the time is you don't do anything alone. You're always taking someone with you in your heart or in your mind, or a little whisper in your ear. And that person might be a grandparent or an ancestor, but it might be a neighbor or somebody who has been your teacher. And it's important to rely on those people. And it is also important to be that person for somebody else. So when you know that there are people who are doing hard things, whether that's facing, a grueling medical treatment, or whether that's facing a landlord who's getting ready to evict you, or city council, or a boss who's really being too difficult, right? Like when any of those things are coming down, if you know someone in your life who's going through that, be sure you're in their ear with lots of love and support so that they know they're not going anywhere alone. And you seek that out for yourself. Find your auntie, find your grandmother, find your grandfather, your uncle. Um, the there have been people that I've known here on the street that sit in the same chair on the same corner year after year. And they are people that I seek out when I'm feeling particularly low, because they will say, yeah, you're doing okay. You're doing the work. And we need that. So I'm going to say to each of you, if you don't have someone actively saying that to you today, hear my voice. You are doing good work. Care for yourself. Keep doing that work and never do it alone. Remember, there's always someone with you.
Yeah, thank you so much for that. That was very profoundly said. Monica, we would love to hear from you.
Sure. Yeah. I know. I mean, I know I'm not the only one feeling like very deeply concerned and disappointed and like enraged, all the things right now with the current like challenging environment. Just anybody who does any values driven work in this climate, whether your work's in reproductive health, rights and justice, or LGBTQ plus work, HIV, public health, disability justice, immigrant health, you name it, like it just feels like every single thing that matters the most is under attack, because it is. And I just like want to take a collective breath and just say like we got each other, and that like we don't do it alone, as folks are saying. And also like it's been an interesting time, like with there's lots of pivots in like language and like what things are titled. And what I have noticed is, in folks that I admire, is that they are like un unapologetically like we are absolutely not changing our core values or our goals. Like we might have to change some words around because of this, that, and the other, for funding reasons or whatever. But I have like found like admiration in the creativity that's come with some of the pivots that have had to happen in the strategy. But I also feel like it's like been a helpful reminder too of like, despite all the disappointing language changes, that like really like a new label or a new title does not erase like decades of mission driven work that came before it. And it's like, let's be real, like terms like DEI like never went far enough in the first place, right? And when it came to like truly naming and like interrogating and fixing the root causes of health inequities and like upending power structures that uphold structural oppression, right? So like DEI like never encapsulated that full picture of what we were truly striving for anyway. And so like I'm not like trying to cry about like specific like terms that we can't use anymore, but I do I will be real that like there's been some real devastating losses. Like, I was like writing a book chapter that had to do with anti-oppression, anti-racism in education. It's like not gonna come out now. There's like there's a lot of like yeah, just I'd say censorship and just repression. All of us have millions of trolls that we're trying to keep at bay. It's definitely like we're already, who the real ones are, who are really all about the work when you're willing to do it when it's not sexy. And it's been like the only thing that has gotten a lot of us through these times has been like healing in community and like supporting each other in community. Yeah, and I am finding, to be honest, I'm finding that I'm having to do a lot of the meaningful work that I want to do that, used to be supported in our like workplace culture or like, by funding or otherwise, like just acknowledgement, at least in our workplaces. I've had to like go back to doing that just in my own personal volunteer time, like our own underground spaces that we're making. Racial caucusing, I still facilitate that and do that, but it's all in on Discord in my own time that, I can't use any of my paid time to do. So like there's a lot of like yeah, there's like decoupling and doing a lot of things completely outside our institutional settings, which is unfortunate because like the burden again and who it falls on, right? But I would say when it comes to like community organizing and community engaged work, that has not changed in our approach, just mostly because I truly believe that community engaged and community led work is the work of dismantling oppression. And I think that work and health justice work is like so inextricably intertwined and like interconnected. And learning from community is inherently about disrupting power structures and dismantling inequalities. So I just feel like we're just gonna keep doing that. And that if anything, community engaged work matters more right now than like ever before. And the like reminder of the examples over time that we can learn from. And yeah, just like, as like one example thing that like we have not changed that happens in our in the course that I teach for our Prime program. Like we have a beautiful like longitudinal partnership we have with Freedom Community Clinic, which is a holistic healing clinic founded by one of our grads and a mentee of mine. And I'm lucky to serve on the board for that awesome clinic. And for the past many years, we've had a like a longitudinal community engagement project that prime students do with Freedom Community Clinic during the capstone course. So like, and it's whatever the community needs are at that time. So like sometimes it's like students doing service learning, making like herbal teas and care packages for folks in the community, or learning from the promotoras. Or like one year they the students helped get the clinic ready for opening their healing ancestral farm, and they were planting and like, you know, creating a community garden. And like another year they ran like a healing arts booth for a community event that was done in partnership with the Black Panther Party's anniversary celebration. So it's like I have to remind myself, like, there are beautiful things happening. There have been beautiful things happening, and we're still doing them. And I try not to get demoralized and really like leading into my my like advice for folks. I try to take my own advice because it is easy to get into the doom scroll like kind of deficit model and like focusing on like all the things we have to dismantle and fight against. And like I'm trying to like use these times to really like revisit my core values and like remind myself to like not let anyone steal your joy, and that like we need joy for movement building, and that like, you know, we need to like we need to take care of ourselves, self-care and community care, and remind ourselves like what the good is in the world worth fighting for. And something that the other advice I have that like I feel like I've been thinking about a lot in the last few years really is like I try to like appreciate all the different strategies, and I try not to dunk on anyone else's strategy, because like I might like at one point in my life the strategy I take is like all about outside disruption and like chaining myself to a building. Like I mean that's what I did when I was, you know, an early activist. That was like my strategy. And like I would dunk on people who were like in the administration, like inside the belly of the beast, and like what they're doing, right? And be like, oh, those people, like nothing's ever gonna change with their like incremental, like, you know, chipping away at things. But I think the more and more, the longer I'm like in this, I realize like, and the different roles I've had to like play, and like the different fighting with like different versions of myself, to be honest, is like, I think in order to truly advance health justice in our medical education and in our institutions is going to be an inside outside job. And like, what I mean by this, I don't think change like can come only from people inside institutions, and it can't only come from like pressure from outside them. Like I think it's from relationships across those boundaries, I think, and across those silos, right? Like we can't just rely on folks inside the belly of the beast, like slowly pushing incremental change that moves at like a snail's pace. Like the revolution will not come from serving on another academic committee. I guarantee you that. But we also can't have like only outside agitators trying to throw rocks like at an institution from their own isolated silos either. Like I think like really we're gonna need to make those walls more porous, and we're gonna have to do it, you know, together. And we need to connect with folks who are down for the real work, both inside and outside. And folks in medical education, but also folks in community organizing and like all the different sectors and disciplines. And yeah, I think that's like what I'm like coming to, is just like really appreciating all the different strategies, and that they're not like against each other. We may have to use them all at the same time, and make room for joy. Don't let anyone steal your joy.